Welcome to Real News. I'm Mark Steiner. Good to have you with us. We at The Real News are planning a number of broadcasts and conversations about the adverse and outsized impact that the COVID-19 pandemic is having on Black and Indigenous communities. Our guest today has been writing about this, most recently in the newspaper The Hill. It's Dr. Benjamin F. Chavis, Jr., who is president and CEO of the storied National Newspaper Publishers Association that represents most of the Black-owned newspapers in the country. He's global director for them for the coronavirus task force. He's a 6-year veteran of the civil rights movement, ordained minister in the United Church of Christ, journalist, author, chemist, and father of 8 children. And of course, was the president of the NAACP. And Dr. Chavis, welcome. Great to have you with us.
Thank you, Mark. It's always good to speak to you and appreciate the work of Real News.
Well, it's good to have you with us and appreciate your work as well over the years. When I saw your head, your bio, it says 60 years. I realized that 2 weeks ago, it was 60 years that I walked my first picket line to end segregation in Baltimore as a kid. So,
absolutely. I think
here we are.
I think we're around the same age, Mark.
That's right. So let's begin. One of the things that is striking me at the moment, I think much of America, is the news now coming out about the inordinate number of members of the African American community in Michigan, in Louisiana, and in Wisconsin that are being affected and infected by this virus and dying from this virus.
In New York too,
and in New York as well.
As soon as the data comes out, and in New Jersey, it's all over the country, Mark, and that is because African Americans, before the coronavirus hit, we were already disproportionately consumed with pre-existing health disparities, pre-existing health maladies. And this made us more vulnerable. It's not that Black people are taking more risks, that's not it. It is that the vulnerability of this disease depends on your immune system. And if you have weakened immune systems because of obesity, diabetes, heart disease, for example, right in Harlem, 60% of all the children in Harlem have asthma. They're not born with asthma. They get asthma because of the poor air quality. So the environmental concerns, the racial justice concerns, the economic justice concerns, all these disparities have made Black Americans and a lot of brothers and sisters on the native lands also, indigenous people, much more vulnerable than the majority of the population. And that is why it's amazing, some people were shocked that more Black people are dying of coronavirus. Well, there's a reason why. And the reason is because of all the history of discrimination, history of disparities, history of disabilities that are visited on our community disproportionately, and the lack of access to quality health care. And also food deserts. If you don't have the right nutrition, your body can't fight off these diseases. You have to have a strong immune system. And what we all know from epidemiology, the immune system is also a function of your nutrition, of what kind of food you eat. And we have food deserts in our community. Even in the urban centers, people don't get a lot of fresh food. So all these things together, it's not one single factor, Mark. It's a combination of complex web of history of oppression, history of economic exploitation, history of the lack of access to healthcare. Now, the question is, once we get through this coronavirus, what is America going to do? We're going to try to make the democracy include healthcare. We're going to try to make the democracy include adequate housing, adequate raising our children up in environments and communities that are safe and not vulnerable to these kind of health epidemics.
Approaching this in a couple of different ways here. I mean, my friend, Dr. Lawrence Brown, who's now at the University of Wisconsin-Madison, has been working on this for years when he was at Morgan State University. And one of the things he talks about is that if you look at the history of redlining in this country, if you look at the history of segregation, what's happened since the end of segregation and deindustrialization and the increased impoverishment of a huge sector of the Black community in the United States in urban areas, living in dystopian communities, bombed out looking communities, that all this kind of feeds into, as you were saying, to why more African Americans are being affected. Like in Louisiana, 1/3 of the population is Black, 70% of the cases are Black.
Right. Keep in mind, Louisiana also has Cancer Alley. That
Right.
means that there were more black people. You know, back in the 1980s, Mark, I coined the term environmental racism. And people say, well, what does that have to do with civil rights, Dr. Chavis? Well, because epidemiologically, it exposes us to all these health hazards because of the gerrymandering, because of poor housing, because of industrial base being right adjacent to our communities. We inhale the fumes, we inhale the things. So, you know, while it is shocking again and alarming, in fact, a week ago, the NMPA, our global coronavirus task force, we declared a state of emergency in Black America around this terrible pandemic. That is, the pandemic itself is indiscriminatory. It'll get anybody, from the Prime Minister of the UK to brothers and sisters on the street corners. But the thing is, who is more vulnerable? And that's the issue that we need to address, that we need to try to have remedied, and not sweep under the carpet until the next pandemic happens.
So this raises two questions I want to raise with you. One has to do with where we are now and what to do in the future. I mean, if you look at where we are now and the kind of real lackadaisical response of the Trump administration to dealing with this pandemic we're facing in this country, and looking now at the adverse effects it's having on Black, Indigenous, and poor communities, what should they be doing at this moment they're not doing to ensure that we get ahead of this while this is happening, so we don't lose tens of thousands of Black Americans, Indigenous people, and poor people in this country to this pandemic?
Well, I think what has been done is not enough by the government, by the federal government. States are to have every state defending for itself is not right. There should have been a national, and it's still not too late, Mark. I think that the federal government, working in concert with all the states, needs to have one plan, and that plan is to get to the communities that are most vulnerable. The Black communities and Indigenous people are most vulnerable. That's where the resources ought to go. That's where the ventilators ought to go. That's where the mask ought to go. You know, we're in somewhat of it's kind of the, we believe that American society is exceptional. Well, that's kind of arrogant, because we should have learned from the other places this pandemic hit before it hit the United States. In China, everybody's required to wear a mask. Everybody's not required to wear a mask here. And then once you have the coronavirus in China, they track you. They don't do that here. So I think there has not been appropriate or proportional or adequate government response. We're still not, this thing, we're not even halfway through this thing, Mark. And I still think the government on an emergency basis now has to act to save lives. We talk about Black Lives Matter. Our hashtag now is Save Black Lives.
So let's take us beyond this. The political question. I mean, it's hard to get away from politics to any of this. But when you look at the lack of universal health care and coverage for people in the United States, and how it adversely affects poor people it's poor people who have to go to work, who cannot telecommute, as you wrote about in your article in The Hill. Yes. And so what do we have to do long term? What lessons do we learn from this to change what goes on in the future for our children, grandchildren, and everybody else?
Well, again, it's a very good question. Number one, we need universal health care for all. Health care should be a right, not a privilege. Right now, healthcare is a privilege. It's an economic privilege. And I think, so number one, we need universal healthcare for all people who live in this country. We can afford it. And look, talk about the cost. Look what happened with the cost of not having universal healthcare. Now, billions of dollars are going to have to be spent to try to repair the economy, repair the communities. And even in the repair, if we're not careful, Mark, all these stimulus packages are going to try to get us back to where we were before the pandemic. But that's the problem. Where we were before the pandemic is also the problem. And in fact, it's going to cost us more if we don't have universal health care. Secondly, I think we have to work on greater economic equity and equality in America. Affordability. People need not only just a job, but a good job. The wages. There was a big argument about whether or not we're going to have the minimum wage between $8 and $15. The minimum wage should be about $25.
Amen to that.
So all these issues, you're right, are going to become public policy. But now, the census is being counted. Well, during this virus, the census is being suppressed. It's going to be inadequate count. I think they need to extend the period of the United States Census. They need to extend the period and making sure that people can register to vote. I think some states, I think Wisconsin did a terrible thing this week, requiring people to go out and vote amidst a pandemic. So so you're right. The politics of this is making a heavier burden on people of color. The politics of this is making a heavy burden on indigenous people. And I think for all Americans, we need one democracy, not two or three different kinds of democracy. We need one society, not a society that is distinguished or discriminated based on race or ethnicity or religion or anything else.
So let me close with that. Was an eloquent statement. Let me close with this question. When you look at this pandemic and the political divide that exists in our country, this pandemic does not stop the kind of political, social, political, and economic battle for equality in America and the world we want to build here in our own country. So how do you see that playing out between now and November? This is a very difficult time. People are stuck. They can't get out of their homes. People can look at you saying they're attacking Trump, you're being divisive. So how do you think we proceed?
Well, I think we have to use what we have in our own hands, as Martin Luther King used to tell us and Adam Clayton Powell used to tell us. What do we have in our hands? We have our vote, we have our count in the census, and we have our responsibility to hold our elected officials accountable at the congressional level, at the state level, at the municipal level, at the county level, and we have to hold our own communities. I think this is just not about pointing a finger at somebody else. We all need to look in our national mirror, our personal mirrors, and see what more we can do to help one another. I think of all these healthcare workers who are risking their own lives to save lives. And I think that we need better wages for teachers, better wages for healthcare workers. I think America now, it's interesting, with all this talk about the stimulus and how to revive the economy, I don't think we can go back to days before this January. I think 2020 has to be a year, a pivot. We have to pivot in America and be more concerned about the least of these, if I could use a biblical phrase. And I think that we need what Martin Luther King used to talk about, the beloved community. The beloved community is not an exclusive community. It is an inclusive community. And that's the central issue, Mark, that we're facing with this coronavirus. We're going to come out of this and have a more inclusive America, or we're going to come out of this even more divided, even more discriminated against, even more oppressed and exploited. That is the essential question. And I think all Americans are going to have to weigh in on how we come out of this at the ballot box in November, and how we come out of this in terms of demanding universal health care.
Well, Dr. Ben Chavis, first, let me thank you for your decades of fighting for an equitable America. And it's been a pleasure to have you here on The Real News. Look forward to many more conversations. Good luck to you, and please stay healthy and safe.
Thank you, Mark. Same to you. Look, we got another 60 years to go, brother.
Yes, we do, bro. Thank you so much, Dr. Chavis.
Thank you. God bless.
And I'm Mark Steiner here for the Real News Network. Please, all of you, stay healthy and safe. Let us know what you think. Stay in touch. Take care.
Thanks a lot for watching. Appreciate it. But do us one more solemn favor. Hit the subscribe button below. You know you want to. Stay up on the videos.